Our respiratory system performs the functions of intake of air rich in oxygen and the exhalation of carbon dioxide. Bronchi form an important part of the respiratory system. A sudden viral inflammation of the bronchi, the larger airways leading to the lungs, is called bronchitis. Acute. The symptoms are dry, hacking cough with stitching pain in the center of the rib cage, clear mucus by and large, expectoration of green or yellow mucus as the infection spreads, oppressive breathing, wheezing, fever. If a patient has a history of heart or lung disease and throws up discolored sputum, please seek medical counsel immediately. Otherwise, the first medicine to think of in bronchitis acute is Antim Tart 200 or 1000. There is rattling of mucus, audible across the room, difficult to take out. The cough is persistent and weakens the patient. There is impending paralysis of the lungs. Antimony tart brings out mucus which resists any other medicine. Simultaneously, to alleviate the stitching pains in the chest, in the center of the ribs, severe pain on the least coughing, administer Bryonia 200 simultaneously with Antim Tart 200 with a gap of 30 minutes. In this case, there is little expectoration, but there is pain in the ribs, and it is worse on least movement. It is worse after eating, drinking. Another way of taking Bryonia would be a dose of 10 pills dissolved in 1/2 of a teacup of lukewarm water, sipped slowly, repeated every few hours. It gives great relief. If bronchitis has followed an attack of influenza, China 200 comes in. There is debility caused by outflow of liquids, mucus, etc. If there is nausea and terrible wheezing, violent difficult breathing, weight on the chest, bleeding from lungs at times, lungs full of mucus, acute bronchitis in infants, give Ipecac 200 and alternate it with Antim Tart 1000 in case it is difficult to take out phlegm. If the expectoration is thick, bland and greenish, add Pulsatilla 30 to fight the infection successfully. If the expectoration is profuse, it is thick, ropey and greenish, give Natrum Sulph 200. Bronchitis, which is chronic, is virtually an irreversible process. The bronchi become narrow, the delicate air sacs of the lungs are destroyed, oxygen supply to the blood is reduced. In chronic cases, when the cough is hard and croupy, accompanied by wheezing, there is inability to raise the sputum, the patient is aged and weak, there is no strength, no appetite, pneumonia and bronchitis have come together. Antimony Jodat 200 is helpful, but get medical help immediately. If there is a burning sensation in the chest with pain in the ribs while coughing and the patient feels oppressed, wants windows open and the expectoration is full of pus, is sweet, administer sulfur 200. Choose the medicines carefully. Most of the time Antim Tart and Bryonia would relieve the condition of acute bronchitis. This condition is more common than understood or believed. I wish you the best of health. Thank you.